Ilham is a past academic dean of 2 nursing colleges in Saudi Arabia, and she's an active member of many institution advisory programs and has several experiences in international and national level. She received many recognition from different institutions, and lately she was awarded the Arab Women Distinguished Award for the year 2021. Currently, she's the Chief Nursing Officer in MHC Mecca Healthcare. She works as a collaborative partner, not only ensures the advancement on an agenda of change, but also enhances communication and provide an opportunity for development of key individuals on the executive team. Dr. Ilham, welcome on stage.
السلام عليكم ورحمة الله وبركاته والصلاة والسلام على سيدنا محمد وعلى آله وصحبه وسلم. First of all, thank you very much for this very special day, honestly. They say ilham in Arabic, it's the meaning of inspiration, but actually today this connections, this conference kept me inspired very much with all the talk that's been there. I'm very honored really to be here and to see the vision that Mr. Malik previously spoke about in 2017 when we were in Eastern Province with a lot of my colleagues. He was envisioning the nursing college, and now it's Magnet Nursing College. I'm very happy, and congratulations for all of you. This is really a very important milestones. The passion that is witnessed in this auditorium testify for how nursing in private is moving very fast. Allow me today to share with you, I have only 10 minutes, and I'll promise most of the time I don't stick to my presentation, but I'll do my best. So what I'm gonna, let's start. Today I'm gonna talk about the system chief of nursing, the role in clusters, which now I have been, blessed, honored, trusted to have served at Mecca Healthcare Cluster as the vice president, in a vice president position. Next. No, that's the old one. It's okay. Okay, so today my introduction, I just put some pictures, but it seems to be the pictures are not there. Those pictures, one of them, it says it was the picture of Mecca and some very of the historical places in Mecca that, I wanted you all, which everybody is familiar and connected to it. And I have started always my presentation in one saying from Quran, قُلْ وَعْمَلُوا إِنَّ اللَّهَ سَيَوْفَ يَرَى عَمَلَكُمْ. And I love this start because it implies in Arabic, it says, it's about the intent. And to me, honestly, I've been tested every single day with this intent in the leadership, in the post that I took, in that move in Mecca. And that's been my own saying, the intent and our intent. This is Mecca. I choose to start. This is here when you see the team, the champions, the nurses, and they are above 100 nurses that has been built in 3 years. And as you see here, that's the mountain of Jabal al-Nur, very spiritual place where lots of pilgrims come from all over the world to this place. What I wanted, when we are talking about the inspiring presentation about resilience in Lebanon, and I was very touched by that. What I've experienced in Mecca, very resilient nurses. When they get overwhelmed with so many challenges, Hajj, Umrah, serving, we go and visit Haram, and we feed the pigeons. And really, we get that energy back, the resilience. So that's what I wanted to share with you, that, my exposure in working with Mecca nurses. Mecca, have its uniqueness. We have 3 in Mecca cluster. We have 3 specialized hospital and 8 general hospital. We're responsible for almost 6,000 nurses and 3,300 almost physicians, and the bed till this present 2,694 bed, 82 healthcare centers, and per the statistic for the total visitors for Mecca region in 2020 was 17.5 million. But the latest statistic now, with opening the Umrah, it is 2 million per month from the visitors. And that's put a big challenge on nurses, clinicians, health providers, and so many, in this area that have a population of 2 million point 5. Why we need to change? We are moving, as we know, to accountable care organization. We're looking at value of care to survive and thrive in the new care environments. We're moving in the Ministry of Health to well-known, recommended four aims: the quadruple aim, population health outcomes, better individual patient care experience, and lowering the cost, high satisfaction for both employee and patients. As well, change management and the leadership, we're looking at building the leadership capacity. And this transformation had started in 2017, and it's continued, where we have seen a lot of changes in healthcare. And still we have a long way to go. But the model of care that's been developed from variety of experiences with consultants, it have been really based on the best practices worldwide from the West, from a lot of global, consultant that worked on this to make it happen for the changes. Very ambitious to look at our structure and how we're gonna be moving, and this is really implies to the role of the nurses in this such system. And little is really known how we prepare our nurses in Saudi Arabia to work, not only nurses, the clinician, and how we can move away from the traditional centric structure to the integrated care, where it's all about systems. How we meet this vision in 2030, and how we can, here is the challenge. So, I looked at, this is an introduction, if we just recall the 4 messages that provided the blueprint for the future of nursing, that nurses should achieve higher level of education. Nurses are full partners with physicians and other healthcare professionals, and this is what will allow us to move forward in the model of care, in implementing the vision and achieving accountable care organization. This is very important as well. At the system level, Chief of Nursing Executive or Chief of Nursing Officers, there has been 3 focused areas. And to be honest, I think we have achieved in cluster the focus area 1 and focus area 3. The role of advanced nursing practice, it's there. Yes, maybe we don't have the accreditation, but it is there on more than one level and more than one cluster, although we still have a bunch of them, but the role is activated because advanced nursing practice is so important for moving forward in healthcare. What we are really struggling is the focused area 2, where we want to bring the interdisciplinary team together and moving from the silos and all our traditional way to go back to the main purposes and to the main important thing that all, as a healthcare provider, we want to achieve. And sometimes it sounds very difficult, but at the same time, it is why we have joined this profession. And it is the core, and sometimes we do really, that's talking about what I have learned. We have to really remind ourselves, it's sometimes simpler than we think, that, in the end, we, all of us, are there to look at the best interest of the patient, to provide patient-centered care, to care. It's about all, that concept. And to be honest, it's very empowering for me as a leader to witness this with working in Mecca, and to learn this, and to learn from the nurses that has been really working on Hajj, on Umrah, on disasters. It's amazing. They have developed that resilience, and they share with you wealth of that exposure, where the interdisciplinary clinician, they jump into situation and they complete each other. But the only thing, we should carry it. I've always told them, I wish all the year is Hajj, because only at that 10 days, the title is gone, everybody is there, everybody's on the ground, and that's what reminds us this is what we're trying to do and achieve in healthcare. I don't want to prolong my presentation. I don't know how much I have still, but I will skip about there's how to guide the cluster into sustainable ACO, and looking at not only our nurse leader, the stakeholders. What does stakeholders expect from nursing? Where do you want to invest in nursing? Still there's a lot of ambiguity in terms of, there is not right or wrong, but still there is ambiguity about the role of nurses on a system level. These are the contributions that nurses may do, and already we are doing in clusters, and it goes step by step, where we look at the gaps. We have an ACO, accountable care organization playbook, and we look at aligning the initiative. When we started in the cluster in Mecca, it was COVID, and we have the requirement to deliver also transformation. So it was COVID, transformation, and we have to come up with the plans at the same time. What we did, we adapted Magnet in model as our framework for the initiative of excellence, the initiative that we proposed, and it was around, in 3 years, it started with 12 initiatives, 12 projects under 3 initiatives, and we ended up with achieving 22 projects in 3 years. I will share with you the system level shared governance that we tried, and we're still learning. We brought it, of course, none of those hospitals have even shared governors, even professional practice model, but we looked at adapting the concept and using it to really implement transformation. How we can get the leadership on the ground. How can we work on the ground, grassroots? And this is where we have formulated the picture that I show you, the 100 champions, and we call them nursing excellence champions. And we adapted this all from the model of Magnet. This is how we started. And every year we are growing, but this is how we achieved standardization in terms of professional practice, looking at quality and patient safety. Even in the COVID, how we achieved, in the nursing practice and the operation, a lot of the manuals, the team approaches. So it was all done through these committees. If you see here, each committee, each council have at least 12 to 14 members. So in total, they're above 100. And all of them, we join them in one group where they are with us and they are our partner in the implementations. So, those are the councils. Lessons learned. Through adopting a system-wide shared governance, we get connected. A lot of the walls were not there. Really just being together in that platform, it was, a learning experience for everyone, involving myself. And it's been like, especially at the COVID, but it break the silos, and it took time to break that and build the trust. And the communication was like, much better, where people approach each other. If they don't know something, they want to ask about any kind of practices, it was like a forum, and it was very healthy. And nurses felt that they had a voice, they can make a difference, and it provided a platform for mentoring of new nurses. And it happened through the timing. Some of the outcomes, all our initiatives were very, we were able to align it with the mission and vision for the transformation and for Mecca. Nurses were the first workforce to do strategy and align, and we enhanced the professional competencies, we built capability, even we have developed the skills that is needed in transformation, such as project management, data management, all those kind of skills that they really needed. This is the initiatives, and we had to do it with no budget. Those initiatives were put in a budget, but unfortunately, we didn't progress to get the budget. So it was 6, the number of initiatives was 6. The project were 22 projects, and we have achieved so far 12 completed with high deliverables, and we are almost 75% on the remaining 10 projects. Our approach was, as I mentioned, bottom up, and there is a challenge in using the bottom up, top-bottom approaches, because everybody's have expectation, and they expect from you to fit in that traditional way of leading, and it takes time to see that the other way of leading it. And now with not only in nursing, in so many aspects, in healthcare and in the VRO office. So it's have to do with a lot of collaboration, openness, transparency, engagement, and these are, so many sessions, everybody was engaged. We work very collaboratively with most of our projects. For example, our residency project is in collaboration with academy, with the human resources. So we try as nurses. We don't do it, we take it alone. We join, the physicians, the health worker, other sector to achieve our goal, and it's really been very positive so far in achieving what we do. And to be honest, without the commitment and the champions and the input and the learning and the support of the CEOs, the clusters, everybody, it takes all of them to make, to get to see result in a short time. Thank you so much. I hope I didn't take much of your time. Thank you.